Good morning, everybody. Welcome to the practical discussion about a 6% increase for certain waiver direct support professionals. This is Mark Davis with the Ohio Provider Resource Association, OPRA, and I'm joined by Director John Martin. I want to start off by giving a heartfelt thank you to Governor Kasich and Director Martin for their persistence and follow through with providing the 6% increase for direct care staff. We're very appreciative of the efforts that they did. We know that it wasn't an easy victory, but we certainly help with that. But we appreciate their leadership. We're going to start off. The slides will be available after today. We will also have a recorded webinar that will be up on the OPRA website as well as the DODD website. That will be available for folks to download or show to your staff or do as you will. And so that will be available afterwards. There is a chat function on your webinar tool. If you have challenges with either hearing or if you have questions, if you could chat us up, and then we'll get to those questions as there's a break in the presentation or at the end, probably at the end for most questions. The provider rate increase. The provider rate increase was targeted towards direct support professionals who provide certain HCBS waiver services. Those services include homemaker personal care routine, homemaker personal care on-site on-call, and shared living. When we did the analysis of the rate and what we needed to do in order to impact direct support professionals, we found that consistently and reliably that 65 to 80% of provider cost goes to direct care staff. So of the average $20 per hour reimbursement for HPC, for example, that 65 to 80% of that reimbursement went to pay for direct support professional cost. We also we know that the entire rate got 6%, and 65 to 80% of it is going to be the subject primarily of this conversation. The other 20 to 35%, providers are free to do with as they will, and we'll get into a little more. We know that that's certainly not enough. We know that it doesn't fill the hole that has been created by inflation and unfunded mandates, but we also know that it is a step in the right direction, and we're headed down a path of sustainability in terms of being able to recruit and retain a quality workforce. We at OPRA and other associations have been talking with our members. We talk with our members consistently about what is their number one priority, what's their number one issue. Without hesitation and by significant margins, when we have voted, our members have said that the ability to attract, retain quality direct support professionals is no doubt their number one issue. We're seeing this also being supported by county boards and family members and folks with disabilities and the state and others know that it is the number one issue. The U.S. Department of Labor, in fact, said that the direct care workforce, direct care job was the number one job in demand over the next 10 years. It's also the number 4 job in demand, number 1 being in the community, number 4 being in institutional care. But we are a heavy-duty job in demand, and we know that it has been consistently our number one issue. So this is meant to address that.
Good morning. This is John, and appreciate you all taking some time to listen to Mark and myself this morning. I also want to say really appreciate the good work that all of you do out there. We know right now that a number of you face real struggles depending on where you are in the state in terms of finding and recruiting direct support professionals as well as retaining them. And so this 6% is something which we hope is going to be helpful, but we certainly know that it isn't the solution to all of the issues that we have. As Mark noted, in his introductory comments, it's 6% on the entirety of the rate, and as I'm sure you're aware, went into effect on January 1st of 2016, and the various services that are covered, which are listed here on the slide: homemaker personal care, on-site on-call, shared living, I think Mark referred to as well on the previous slide. I mean, the intent is certainly that the 6% is going to the direct service professionals who do the work and who are really the backbone of our system that we, count on for providing the quality services that you all do out there. So we recognize that, and our hope is that this is not a once and done sort of increase. And we'll talk about in the slideshow here some things that you all can be really helpful with that will help us preventing this from being a once and done sort of initiative. And I think that's the real intent. We know that since these rates were set now almost 10 years ago, 9-10 years ago, there's been substantial inflation while the rates have been stagnant. So with that, Mark, I'll kick it back to you. And
thank you, Director. I want to talk about the assurance of the DSP wage impact. Again, the purpose of this increase and what we sold it on to the legislature and to the governor was the direct care workforce crisis. When I had a conversation personally with the governor about it, he promised that he would do something about it. I promised him the money would go to direct care staff and other expenses, but that the tip of the spear, if you will, would be direct care staff. We also made that covenant with Director Martin and with Director Moody and McCarthy, and said that this would go for direct care staff, that they would see an equivalent, a commensurate increase, mainly 6% on 100% of the rate, but 6% on the wage increase for staff. We then talked with the legislature and supported Governor Kasich's ask to do this, and we made that same commitment to them. And then we talked with other stakeholders, and the ARC, the County Boards Association, and a number of others. There's too many to mention, really, a lot of other stakeholders. And without exception, every one of them said, we want to support this, but how will you make sure that it goes to direct care staff? So it wasn't that they didn't want to support us, it was just that they wanted to make sure that our covenant, our agreement, that the staff would get a commensurate increase in their money in their pocket, that would occur. And Director Martin's going to talk about how the department is going to do that, because this is state money, that we're very appreciative of all of those folks, all the stakeholders. We had county boards, we had superintendents, we had family members, we had a DRO, we had other APSI, we had a lot, and again, too many to mention stakeholders, and we greatly appreciate their support. They all were providing testimony in the budget hearing supporting our direct care wage increase. So to say that this is for anything but direct care wage increase would be perhaps a misstatement. It's certainly direct care increase, but it's also for those other inflationary factors that help support the work that we do. But again, and we'll talk about the distribution of it, there is some left in the rate for whatever the provider wants to do with it, but the majority of this is going to go to our direct care staff. So I'll turn it over to Director Martin now to talk about how they're going to, how the department will assure the increase in wages.
Yeah, so as Mark indicated, we often received that question, and I know it came to me numerous times. So how are you going to assure that the money is getting where you say it's going to go, which was to direct service staff wages? And so one of the things that we didn't want to do was to go to a cost report system or something like that. And we were aware, as you know, we use the NCI, the National Core Indicators, for the quality measures in our system, but they also have a staff stability survey. So we experimented with that, and I appreciate probably a number of you on the phone helped us with experimenting with that in some pilot trial runs that we did with that over the last couple of years. And so what we will be doing is that in the next week, you will be receiving a copy of the NCI survey. It's an online survey tool. And what it will do is it will ask you to report back on 2015, things like the average pay of your staff, your starting rate, all of those sorts of things. And so 2015 will give us a baseline in terms of what the system looked like prior to the increase. And then next year at this time, we will essentially be doing the same survey again. And what we expect to see then is that 6% increase will actually show up, and we will be able to see it. Now, I also want that in talking to some of you, we've added some things to the survey that we think will be really helpful. We know that some of you, and Mark is going to talk a couple of slides down about different ways of giving the increase and some of the flexibility that exists there. And so we have tried to adapt the survey to be more flexible as well, to reflect the decisions that you may be making as an employer. And simply then by changing, it will enable us to get a better sense of what's going on there and how the money is getting to direct service staff. And we're going to ask you about overtime. You know, we're hearing, because of staff shortages, a lot of overtime increase. So we're kind of curious as to what we'd see there. There's an opportunity now, as I mentioned before, to put bonuses in. And then we have a couple of lines at the end where you have an opportunity to just in 2 or 3 sentences explain to us how you use that 6% increase. And that'll be really helpful, because as we go for the next budget, some of the anecdotal stories I'll be able to tell about where the money went will come from those 2 questions, as well as what we're seeing on the survey. So again, that will I think help legislators and others in our field, you know, get a sense the money's going to where it's supposed to be going, and it'll allow us to have a method to talk about it.
We're going to talk now about the rate methodology. The homemaker personal care rate, all of our rates basically were in their roots based on a specific rate methodology developed by a consultant, EP&P. Opera worked on that. It was one of the first things I worked on when I came to Opera years ago, and then it passed in and was effective in 2005. So these are the 6 components of the rate. Now, the emphasis here is so everybody can look at this and understand that there are not just the direct care components of the rate, but there are other components, and those got the increase too. So let's go over those. Direct care is one. That's a direct care wage. The second is direct care employee-related expenses. The third is supervisors. Supervisors was based on a 1-to-10 ratio at the time, and that was based in part on a provider survey that was done, for those of you who remember that, back before the turn of the century, right around the turn of the century, actually. The supervisor employee-related expenses, productivity assumption, which is basically out of the hours worked, how many of those hours are billable for that service, and then administration. So we have 6 components of the rate. 2, you could argue, and I would, that 2 out of those 6 are for direct care staff. 4 out of the 6 are for others, and that's where you look at the 20 to 35% are in those 4 categories, and about 65 to 80% are in those first 2 categories. Now, what we're measuring, be very clear about what we're measuring, is the direct care, only that one category, the direct care wage, and it's the base wage, not including overtime or any other factors. So, but we know that the employee-related expenses like overtime and other employee-related expenses like healthcare, et cetera, and taxes are included in your actual expense. So as we go to the distribution model next, when we go to the next model, you'll see that we've included that in there to show how much money you may have left over, or how you can, this is a model you can use to calculate how much money you have left over after you do the 6% wage increase to staff. The average direct support professional wage in 2013, according to the Opera survey, was $9.54. We are currently doing another survey. Now we should have the results in another month or 2, so we will update this, but this is where it was in 2013. Overtime, and I'll get to the validation in a second here. Overtime, we're plugging in at 15%. So we know that if you give 6% to staff and then you have a certain rate of overtime, that increases our expense, right? So we've got to calculate that in in terms of what money's left over after you do the 6% to the base wage. Employee-related expenses is plugged in at 30%. When I've taught, and then the average total cost, when you take $9.54, you plug in 15% overtime and then 30% employee-related expenses. The average total cost of the DSP wage and ERA with overtime factor. So for every hour we deliver of service, of HPC of service, is $13.21. And when I talk with other our members and accountants and other folks, they say that's about right. So the overtime may be high, it may be low, the ERE may be high or low, the wage may be high or low, but when you add those three components together, I've not had one provider yet tell me that that's too far out of the ballpark. So it's in the neighborhood of $13.21 to provide a direct support staff hour. So if you take the $9.54 and multiply it times 1.06, which is the 6% increase, you get $10.11. So that would be like the new DSP average. Granted, it's not going to be, again, it's going to be based on what your wage is, but this is just for demonstration purposes, and we do think it's in the ballpark. The rate distribution then is based on an average rate of $20 per hour, which is the statewide average rate. So that 6% would be an additional $1.20 per hour. So that's what we had to look. We looked at, well, how do you distribute that then? 79 cents, according to this model, or 2/3 of it, 66%, would go for the DSP wage, overtime, and ERE. The remaining, which was the part that we have complete flexibility on, well, complete within the bounds of the law, would be 41 cents, or about a little over 1/3 of the rate. So about 1/3 of the rate increase is going to go for filling the hole that inflation has left, any kind of increases in health care, the increases in minimum wage, everything else. It's going to go help that. Again, we know it's not enough. We know it's not enough, but it's a step in the right direction. 2/3 will go for an increase to the base wage of the employee and the related expenses of overtime and employee-related expenses. I'm going to talk a little bit about how you can get the money out then into the base wage of employees. The simplest way is across the board wage increases. So every DSP and HPC, on-site, on-call, and shared living, everybody gets a 6% increase. That's certainly what's going to happen to independent providers. With agency providers, you have much more flexibility in terms of where it goes. And you can do the 6%, although I think this really is, we really ought to think, and I know a lot of folks have, and you've already done it, but really think about this as an opportunity to make sure that your reimbursement policies align with your agency culture, your agency values, what you think is important, and your agency needs. So if you have some difficulty filling certain shifts, for example, you can give differentials for certain shifts. You can do differentials for acuity of the individuals who are being supported. So someone with significant behavioral or medical issues, you could do a differential. So you could give a certain group of employees, for example, a 7% increase, half the employees, and you can give the other half of the employees a 5% increase, and you're averaging 6% across the board, and you're making sure that your reimbursement policies align with your agency's mission and vision and values and culture and in a way, and their needs. So you can really use this as an opportunity to move your agency in the direction that you want it to go. You can also do geographic. We know, for example, that a few months ago, last time I looked at the unemployment stats, Mercer County was at 2.8% unemployment, lowest in the state. Then you go to a county in southeastern Ohio, and it was closer to almost 8%. So you may not need to give someone, you may not have the same recruitment needs in one county as you might in Mercer County, and I'm not just saying Mercer County, so a county with lower unemployment. So you could give a 7% increase or an 8% increase in those counties of lower unemployment, and you could give a 4% increase in the counties with higher unemployment, and you'd average you'd average 6. Just do it so it averages 6%, according to how your employees are distributed too. You could do it for longevity of individual staff. We know that the majority of turnover, one of the significant time periods, and the majority of turnover occurs within the first 6 months of hire, typically within the first 90 days. So you may be able to build in something like if there a 90-day bonus, a 6-month bonus, but then you also, into the wage, or a bonus for people 5 years, 10 years, anybody there more than 15 years, you can increase their salary a bit, or again, do a bonus. You can also do merit. Some agencies have built-in merit procedures, so you could give more money to a direct support professional who, let's say, is better at documenting everything and in working with clients has less, MUIs, maybe, I don't know, and maybe is better at achieving outcomes would be one that I would like to look at. So you could do merit ones as well. And you also, I'm going to skip down a little bit. You also can do bonuses. So you can do bonuses. You can also delay the increase. But I wouldn't recommend this, but you can do it if your situation calls for it. So you could have 0% increase until July 1, and then July 1 do a 12% increase, and then you average 6% for the year. But remember that 12% is going to live in the next year, so you've got to live with that. That's why I wouldn't recommend it. But again, your agency may be able to do that. You may have fallen into some money or efficiencies that allow you to do that. That's certainly an option. I want the period January through December 16th was the impact period that we want to see the impact in. And I want to say, and we said this several times, but I want to say it again, that the 6% is not included in overtime. It's not included in the employee-related expenses. It's only in the base wage. So it's money in the person's pocket based on their base wage. You saw the calculation that I did and that I've done and have been validated by other of our members, where it looks like that'll take about 2/3 of the rate increase, and 1/3 of the rate, little over 1/3 of the rate increase, will be left over for providers to fill the hole that inflation has caused. We know, again, that it's not enough. We know that there's been 21.3% inflation since the rates were set around that, and that there's been 6.7% increase in the rates. We know that it's not enough. But we also know that this is what we sold it on, and this is what everybody has said is our #1 issue. So we need to have integrity around our ask and around the distribution of the money. Finally, we think it's very important that you communicate to all staff how the wage increase is going to happen, to whom the increases are distributed, and why. So if you have staff in adult day services or in ICFs, as opposed to someone in routine HPC where most of our services are delivered, the people in the other services may not be getting increases. We're looking at about a 2% for increase on the ICF side in July 1, but again, we're looking at how that might play out. It may be different by agency to agency because of the cost-based reimbursement system. So I think it's really important, we think it's really important to clearly communicate and to be transparent with staff about how these rates are being distributed, how the increase is being distributed to their pockets, and that there are going to be some staff, because of the service they're in, that may not be eligible for this. So it's, again, really important that staff know that up front, because we're concerned about them communicating something other than that to the broader public, and we certainly don't want to jeopardize any asks for future increases that we've already started planning and talking to people about. Again, the importance of getting this to direct care staff is because they do the work, right? They are our #1 issue. They do the work and they deserve it. The other reason for doing it is because if we don't do it and can't prove that we do it, then we put in jeopardy, and I would say we eliminate the possibility for any future increases over the next perhaps 10 years. So if we do it, we've got hope for future increases to help fill that gap. If we don't, then we're just not going to have that hope.
Yeah, so just kind of a couple of words of summary in terms of what Mark was just describing, and that is that the state is not at all mandating or suggesting how you give the 6% increase. And so I think Mark did a great job of giving you a lot of different options that, again, may work for the value and the culture of one agency, but is not going to fit the values and culture of another agency. So what we're saying is, you have a lot of flexibility in doing this. What you don't have flexibility in is not giving the money to the staff. And, that's something that we really want to see and need to see demonstrated is that to the staff. And to emphasize the other thing that kind of Mark ended up about describing to your staff, that becomes important in describing to your staff how your agency is choosing to distribute this money to staff. I was in a meeting with a large group of families a couple of months ago, and one of their questions to me was, how are you going to assure the money gets to where it's supposed to be? We want it to go to the staff working in our sons or daughters' homes. And I said, my simple answer was, ask them. Ask the people working in your home if they got an increase. So that will happen out there. And if the word gets back to these associations, et cetera, oh, I don't know where it went, I didn't see it. Again, remember, we all have to be ambassadors for this, and our staff are some of the best ambassadors we have. So make sure you take that time to explain it to them so that they have that awareness. Also, we heard a report or two where a provider was told, well, since you got this increase, we don't need to give as much money for room and board. And we want to point out that this increase, that Medicaid dollars, HPC dollars, where this is intended to go, it's actually illegal to be using this money for room and board. So this money needs to go, and we have those categories that Mark went over with you that were used in building the rates, and you'll note room and board is not in any of those categories. So that's not an expectation in terms of where that should be. We do know that some of you have unionized environments that you work in, and I believe Opera has perhaps done some specialized work in that area, and will continue to do that. And back again, we've hit this point. You see it on the list here. How will DODD assure the wage increase? And again, we're doing it with the survey. But I want to point out that the survey itself is confidential. So the department will not be, we will not know that XYZ agency, we will not know when we read the reports. We don't know who submitted them. And it's because all the information will go to HRSI, who's our survey company, and they will then be consolidating that information and feeding it back to us on an aggregate basis rather than on an individual provider basis. So submissions are confidential. The only thing that is not confidential to us is who responded and who didn't. So we've developed something with HRSI where we will be, as I mentioned earlier, sending this out in about a week. It'll be out there. You're going to have ample time to fill it out, and HRSI will then give us regular reports on who has responded and who hasn't. And so we'd ask you to please cooperate and get it done as soon as you can, so that we don't have to spend a lot of time running folks down. So again, just wanted to clarify, if we know, even if you get a call and you say, oh, they know I didn't submit mine, that must be they're looking at my reports. That is not the case. I wanted to clarify that. We don't see individual agency things. Just a note at the beginning that I missed, again, the DRA spans, which those of you who do the technical work out there probably know that the spans need to be, or should have been, broken at the first of the year as we went from December to January. So the penalty, what will happen to providers who don't give their DSPs an average raise, it just hurts us all. And if providers don't use it in that way, that word starts getting out. It's going to really hurt Mark and Jeff and others from Opera as they work in the legislature. It'll hurt us as we work with administration in the legislature as well. So our jobs become a lot easier to sell this if good feedback is coming back into the system.
I think also another byproduct of that will be that your staff will be going to other agencies. Direct care staff, we know it's a very small world. They talk with each other. They're going to know who got a wage increase and in what format, how it was distributed, and so they'll be talking with each other. And I think it's probably will turn out to be a bad business decision if it's not passed on to the staff.
Yeah, and so when we talk about that, we're hoping on the next slide where this is a down payment. Again, what our hope is that this is not a once and done sort of project. And so we would be hoping that in the future to continue to be able to increase the pay of the direct service staff. But again, that will really link back. We really need your support and help as we move forward on that. There's a few other system reform initiatives which Mark is going to make a few comments on as we're working through the slide. So Mark, you want to take it away?
Sure. We have approached our direct care staff crisis with a three-pronged approach. For those of you who heard this, you know what we're talking about, but I'll repeat it. One is direct care staff wages. That's our number one approach, number one strategy. This is a step in that direction. Obviously, we are doing that with this, but it's not just about money. It's also about system reform. It's about system reform that enables us to reinvest the efficiency dividends in direct care staff and in the waiting list and into budget stability for counties and for the states. So some of those reform initiatives are the waiver pilot. We're looking at, as a result of that, perhaps residential habilitation. We're looking at healthcare coordination, how we can better coordinate the healthcare needs of people with developmental disabilities. We're looking at the integration of long-term services and support and healthcare. So how do we better support, get better outcomes in both across the entire Medicaid spend and also in Medicare. We're also looking at developing the C3PO project in ways in which we can encourage folks to get into the direct support profession. If you're not familiar with the Community Connections Career Partnerships Ohio program, it's a pilot, but it's very successful. It's got 12 students in Southwestern city schools. 12 students started it. 12 students are still in it. It's basically, we developed an alternative pathway for students who are at risk of dropping out to graduation, to get a high school diploma, but also while they're doing that, to get more information about the direct support profession and to actually earn their certificate of initial proficiency through DS-PAS in their junior year and their certificate of advanced proficiency from DS-PAS in their second year. So 1 day a week they're in the classroom, learning about developmental disabilities, learning about what it takes to be a direct support professional, developing their portfolios for application for their CIP or NCAP. The other 4 days a week, they're in a mentorship program out in our member agencies, working with people with developmental disabilities, and I can tell you the results have been phenomenal. We have these students that are saying things to us. Their biggest complaint is that they want to do more with people with developmental disabilities. They had a school system visit them. They gave witness to what they were doing. One of the students said, they asked them, what do you want to be when you get out of high school? The one student said, I want to be a nurse, but let me be clear, I want to work with people with intellectual and developmental disabilities. They were actually using words like high functioning, low functioning, and lifts. And I mean, they knew the industry technology. So we're going to have 12 highly trained direct support professionals. They're going to be 18 with a high school diploma that are coming out in another year. They're juniors now. So it's those kind of creative, innovative programs, the weekly rate, the residential habilitation, C3PO, that we're trying to really use our money more wisely in the system and then be able to reinvest that in our direct care staff and in the waiting list and in the state and county budgets. The third prong, so it's more money in the pockets, system reform, and the third prong is to improve the environment of work. The main reason, when studies show, the main reason that folks come to work, one of the main reasons is pay, and pay matters. It's very important. But one of the main reason people leave their job is because a lack of feeling of empowerment and an ability to impact the work that they do. So we need to move more towards outcomes, more towards freeing up direct support professionals to be more creative and innovative and flexible within the interventions that they provide to achieve specific outcomes. And so we're looking at, and also do some supervisory training. That's what part of this rate could go for as well, to get better supervisors, better trained supervisors, and to really look at other retention strategies for our direct care staff. So again, more money, clearly an issue for us, but we also are looking at system reform and improve the work environment. If you're interested in participating in the solution for direct care staff and sustainability of quality direct care staff, please let me know or the department know. We'd be happy to get you involved in that work. Together, I think we can change the system, really make a difference, and because the current system is not sustainable, and we know that. The last thing I wanted to close with for me before we open it up for questions is that, so if you can chat up some questions, that would be helpful. The last thing is that in this world of politics that we play in, and Medicaid operates in a political environment, we are price takers, not price setters. We operate on the price set by the legislature and by the federal government and by the administration. And so in that environment, our integrity it matters. I mean, our word is the only currency we have. And the way that currency gets value is by us doing what we say we're going to do. And that's as a community of providers, county boards, family members, all of us working together to make this work. So again, our integrity really matters around this. We appreciate everybody's efforts to get this to the direct care staff, and also appreciate, again, Governor Kasich and Director Martin's understanding that there's other costs that went up, so it's not just, the whole rate doesn't go to direct care staff. There are about a third of the rate from our estimation can be used to plug other holes, but we, again, really emphasize that our integrity matters and that it needs to go to direct care staff and at least 6% of their base wage. So at this point, we'll open it up to questions on the screen.
The first one there, somebody indicated they got here a little late, and it says, do all staff have to have a 6% increase, whether it's in a bonus or hourly wage? So the answer is, I guess, both yes and no. Yes, in that we really expect to see a 6% increase to the direct service staff. The no part of it would be, if you go back, Mark was giving you a whole bunch of examples of how you might use this additional funds based on, your agency's values. And, he talked about bonuses. He talked about shift differentials, longevity, etc. So those are examples, and I think he gave an example where maybe one person or one group of people actually got a 8% increase, and another group of people got a 4% increase. And because that you were valuing a particular aspect within your agency. So again, that's why kind of a yes and no. We absolutely expect 6% increase overall to your workforce. We do recognize that some people might get more and some people might get less as you reward what's important to your agency.
Will this apply to self-employed IO waivers? Yes, it is. The rate has been automatically adjusted, should be automatically adjusted to independent providers. If that's not the case, please talk to your local county board. If you don't get resolution there, then you can contact the department.
Mm-hmm.
What? All right. The handouts will be available, yes. Handouts and a recording of this session will be available. What is the outlook on ADS VH receiving an increase? The ADS rates, we understand, will be submitted in July of this year, and to be effective October.
I'm not sure.
We just heard October, so I don't know if that's true or not. Oh, I don't know if it's true. I don't know if it's going to happen. It's the plan. It is true, but I'm not sure it's the plan. So we're looking at implementing a performance-based reimbursement system in ADS. So look for that to be structured a little differently. They will mirror some of the self rates. So the IO in level 1 may see a slight adjustment in their rates, but we are not at this point have anything on the books for a major increase in adult day services. If you look at the rate methodology for adult day services, the base rate in adult day services was $51 an hour, and the base rate in HBC was $18 an hour. So we felt that really where the money needed to go was to not, it's also the most used services routine HBC, but in the one that we felt was most underfunded. So that was the thinking there.
In terms of the survey, wonder why you haven't gotten anything yet. It will go out in about a week. We have changed and modified the questions. So we've made those changes, or they're being made right now. And again, it will go out in about a week. If you don't get one, at the end of this slide, you'll see Tina Evans, who's here in the room with us. You'll see her contact information, and she is who you would coordinate back with if you don't get it.
What if my agency is already paying staff more than other agencies to keep good staff, i.e. $10 per hour? We understand that the range for direct care staff on our state ranges to over from about $8.50 to $8 actually, right around minimum wage, up to over $12 an hour. So we know there's a broad kind of a range, and some of that is based on geography, some of it's based on culture, some of it's based on commitment to direct care staff that people are able to fund through fundraising or through other efficiencies. But
well, and not plus. Sorry to interrupt, Mark. Plus, you know, some providers will make a choice that they think their employees would rather have a higher hourly rate and less money put into insurance.
Right.
And so you'll see a lot of variability based on that sort of thing as well.
Right, and the 6% is regardless of what you're paying your staff now.
Yeah.
So if you're paying your staff $10 an hour now, you need to average $10.60 an hour. If you're paying and if you're averaging $12 an hour, you need to average $12.72 an hour. And it may be counterintuitive, but it's the only way we have to assure that staff get a 6% increase. And again, that's what we sold it on. So you know, the answer is that we are expecting a 6% increase to all staff. However you did it before, you got an additional 6% on top of that with some wiggle room. So we think that it is feasible. Granted, people that are paying their staff more now will have less wiggle room, and people that are paying their staff the other way will not. But we also think that folks that are paying their staff more, and you said it best in your question, because you want to retain good staff, and I think that'll continue to be the trend, and I think you'll continue to do well, and I think that's a smart business decision. What was fully meant regarding the DRA span was to be broken?
Well, yeah, I didn't mean broken. I meant we kind of starting new, or maybe it's another way of saying it, January 1st, that the new rates, you know, figured into the DRA versus the old rates from the year before.
So you just need to not blend the rates from 2015 to 2016, or it'll increase, right, artificially increase 15 and water down 16. So
better
break is, I like break, but yeah, just stop and start. Yeah, we have found it very beneficial to give more than a 6% increase to all staff other than on-site on-call. We left our on-site on-call at minimum wage, which has never been a problem getting shifts filled to sleep for minimum wage. Therefore, we gave about 9 to 11% on second shift, which made all of employees very happy, and we've been able to hire many more qualified employees. Our overtime was drastically dropped, which is a win-win. Thank you for everyone getting involved in our great state, getting our great state a well-needed increase. That's a very good example.
Yep.
That's a very good example of the flexibility that we're talking about here. Very good example of that.
You're rewarding what's important to you
and where your needs are. You have no trouble finding on-site on-call staff, and minimum wage is a crush. But then you need staff and routine, so you give a bit. That's a really good example of that.
How is the state going to take into account the high turnover rate, looking at the base rate of DSPs, where an agency may have given a 6% increase, but due to turnover of more highly paid employees and replaced by lower paid new hires, the base rate actually goes down? Again, you're going to want to get that additional 6%. So we recognize that agencies will have this, but we're going to be looking at comparing what you were paying your staff the previous year to what you're paying them now, and looking for that 6% increase. And we again recognize there'll be some nuances there, but we want to make sure that overall increase is 6%.
Yeah, and what you need to do is you need to, and the director mentioned this earlier, that at the end of the survey there will be a place where they're going to ask the question, just bold-faced question, how did you implement the 6%? And at that point, you would need to write that in there, and just to say, this is how we implemented the 6%. Our pay scale went up by 6%, but because of the shifting of employees, we know that's going to happen. So that's not an issue. As long as you let folks know let us know, and let basically the department know in the survey, so basically let HSRI know that that's how you did that. Have all county boards updated MSS sites to include the increase our county had not as of January 27th? not sure if it has been corrected.
We'll have to look into that. I don't know the answer off the top of my head on that.
It should have been. We know that because there's a lot of work being done with everything going on, so that we know that there were some that were a little behind. But if there are some counties still behind, please let us know, and we'll look into that.
Yeah. So if you'd ask us on a county-by-county basis, again, there's some information at the end of this on who you can contact and how you can contact us. So you can shoot it into Tina, and she'll get it to the right folks here to make sure that we take a look at it.
We have a deficit because of a proactive increase we gave last year. How do we compensate for yet another increase of 6%? You know, the increase was, I know that's a difficult situation for you, and I appreciate that, and also appreciate you giving your staff the increase. Last year, we were very clear with OPRA, with our communications, and I think the department was too, and other folks suggesting that people, I know it's too late, but kind of saying that might not work because of this. But however you did your math last year to accommodate the increase would have been on the old rates, presumably, and then the new rates were effective January 1. So the logic is that, you know, this is, again, we know it's not enough. We know it's not going to wipe out some deficits for folks, but that it is additional funding as of January 1. So we're, you know, unfortunately in your situation, we're still holding people accountable to giving a 6% increase in the base wage. And we know that we've heard this from more than one provider that did it kind of prematurely. But again, they also said they did it because they needed to keep staff and to retain staff, and as a competitive advantage in the marketplace, they felt that it was effective for them. But they need to give another 6% this year. And I wish there was another way we could do that. I really do, because it doesn't sound right, but it's what we sold it on, and it's the way that we communicated it. So, all right, we're going to give you on the last page, while we're allowing people time to type in any other responses or questions, there are resources. If you have any questions about the provider wage increase survey questions, those can go to Tina Evans, and her Tina's email is on the slides that you'll have. Provider rate distribution questions, like the last one, can be directed to me, and there's my email. And questions from county boards may be directed to Lori Stampa. So, and there's her email. That's questions from county boards, not about county boards. If they're provider questions, you can send them to me. Systems questions, you can send them to Tina. And from county boards, you can send it to Lori. So we don't have any other questions showing. So I at this point would just like to wrap it up by saying we appreciate your time and effort, and we look forward to continuing to work on achieving a sustainable, quality direct support workforce on those three prongs of increase their wages, system reform, and improving the experience of work. And hopefully we'll all continue to work together on that. I don't know if you want to.
Yeah, just want to thank everybody for giving up an hour of your time to listen to Mark and I on this topic, which we feel is pretty important. And also would like to, as I started at the beginning, saying, again, really appreciate the work that you all do out there. We know it's not easy, and we appreciate what you do every day, and we're hoping that this 6%, at least in some way, makes your jobs a little easier. So thanks again, and have a good rest of the day.
Thank you.